Hi, and welcome to Hill Ponton's VA Disability blog. I'm Natalia Joffrey, the company's COO.
And I'm attorney Rachel Cheek.
And today we're going to be talking about VA disability claims and ratings for arthritis. So, Rachel, maybe if you can start off by telling everyone what some common forms of arthritis are, because they're
Absolutely.
not all the same. People always say, I have arthritis, but there's different types. So,
You're right. So the two main types that you'll see are degenerative arthritis, and that is kind of what we commonly think of as arthritis. It's also called osteoarthritis. It is essentially kind of associated with the wear and tear of the joints. And
mhm,
then you also have rheumatoid arthritis, and that is not a wear and tear condition. It's an immune disorder, actually. So
mhm,
if you have rheumatoid arthritis, basically your immune system kind of attacks the joints, makes them stiff, swollen, hard to bend. So they are similar in that they both conditions affect the joints, but the process by which rheumatoid arthritis and degenerative arthritis occur are different.
okay. So that's basically the difference between the two. One is more of an immunological disorder. And I believe that you can have actual, well, I guess you could have tests for either, but one is more of an immunological disorder and the other one is more wear and tear, right?
Sure. Yes, and I should mention rheumatoid arthritis. I mentioned degenerative was something that
Mhm.
older people often get. You can get rheumatoid arthritis at any age.
Okay. All right. Yes. And I've seen really young individuals get rheumatoid
Mhm.
arthritis. What are some common causes of arthritis due to service?
Very common is basically hard impact work. So,
Uh-huh.
for example, we see this a lot with clients who are paratroopers. Obviously, as you can
Mhm.
imagine, landing from several dozen, 100 feet in the air with
Mhm.
several hundred pounds of equipment. Um, time and time and time again, that takes an impact on your knees, your back.
Right, right.
Also, I do notice I see clients who've had injuries during service, which at the time just seemed minor, and then they may have gotten a car accident and gotten some whiplash or something like that. Over time, the wear and tear can go on and develop into arthritis later on.
I'm glad you mentioned that because, when you give the paratrooper example, it's inferred and people understand, well, clearly, he or she were doing something while in service and it was a direct result of that. But you could be out playing football and on your drive home have a car accident. And if that later turns into degenerative arthritis, that's still service connected, even though you weren't directly working
Mhm.
or actively performing, I guess, a military task at the time of your injury, right? I
Yep.
mean, it's important for people to understand that if it happened while it was in service, it still falls under the same umbrella, whether it was
Exactly.
recreational or, I like that you always give a disclaimer though, Rachel, which is the exception about unless you're breaking the law.
Yes, that is an exception. If you break the law during active duty service and get injured, there's not much VA can do for you.
So, Rachel, can you tell everyone how does the VA rate for arthritis?
Sure. So we'll start with degenerative arthritis. Essentially, the way that degenerative arthritis is rated is based on the limitation of motion. We'll use the example of going to a CMP exam for your arthritis of the hip, let's say.
Mhm.
So the way that each joint moves there's a certain range of motion that's normal. So for
Mhm.
example, moving your hip, moving your leg, moving it backwards would be considered extension, moving it forwards would be considered flexion. There's a normal range of motion for each of those directions. What
Mhm.
will happen is if you have that arthritis, say, affecting your hips, you're not going to be able to achieve that same range of motion. Your range of
Right.
motion is going to be limited. So
Uh-huh.
what happens, the way that it's rated is would be based upon a CMP exam where a doctor would examine you for whichever joint. Again, we'll use the hip as an example. And they'll measure basically, okay, here's the normal extension and flexion for a hip. Okay, what is yours? They use a tool that essentially measures the angles that you can achieve. Now, I use the hip as an example because you can actually get separate ratings
Mhm.
depending on how limited your motion is. So, say you can take your leg backwards, you can extend it a little bit,
Mhm.
but you can't bring it forward. You can get rated based upon that limitation of flexion, based upon you can't move it forward, but you might not be able to get it if your limited movement backward is normal.
Mhm.
However, if you have limitation both of flexion and extension, you can get two separate ratings based
Mhm.
upon how severe that limitation is.
Oh, wow.
Yeah,
Okay.
and the higher the more limited your range of motion is, the higher the ratings go. I
Mhm.
use the hip as an example as well because there's actually a third limitation that they will include. So, say you've got your legs.
Mhm.
Okay, so you can also be rated. So you're rated for extension, flexion, and you can also be rated if you're unable to, say, cross your legs. This is called
Oh.
adduction. If you
Mhm.
can't rotate, I can't rotate my finger out. If you can't rotate your foot out, those types of things basically depends on which joint can do which motion. Um, and the VA will take into account all of the different limitations that you have. This is the same for, say, your leg, your knee. You can stretch it out all the way, but you can't bend it back all the way,
Right.
or you can't stretch it and you can't bend it. You can get two separate ratings.
Oh, wow. So you could basically get like a 10% for one and a 30% for the other, or 10% for each? Is that how that's gonna
Mhm.
work?
If your motion is limited in that way.
Are there, other tests that the VA can do to prove that you have arthritis? So, like, you just gave us this wonderfully thorough explanation, regarding the range of motion and how that's basically, tested. But for example, like with rheumatoid arthritis, are there, objective tests that the VA can run to prove that you in fact have, this condition or another?
So with rheumatoid arthritis, I'm glad you asked. It's rated differently because it's an immune disorder. It can have kind of flare-ups and what they call exacerbations from time to time. So
Mm,
the rating schedule for rheumatoid arthritis is actually different. You can be based on limitation of motion if it depends. Generally, rheumatoid arthritis is going to get higher ratings than
mhm.
degenerative arthritis. If you have a severe condition that requires, basically you have to be treated multiple times, they kind of base it on how often you have exacerbations of your rheumatoid arthritis, because some days you can be okay, other days it can flare up and really cause problems. They will look at your joints for swelling and that kind of thing.
So if you're not in the middle of having an exacerbation, is that gonna hurt you in terms of your right rating finding, or can they still
So
diagnose you?
yeah, you can still be diagnosed. And for rheumatoid arthritis, obviously, the VA is not following you every single step of the way, monitoring everything, unless you get treatment from the VA. Which,
Mhm.
but what you can do is provide evidence, showing, or just say, okay, this has happened 2 times in the past year. I went in the doctor's office for this. I was treated for this, and similarly for degenerative arthritis, for all orthopedic conditions. Um, the CMP examiners are required to take your statement about whether or not you have flare-ups. So some days, just as you mentioned, some days can be better than others for anyone with any kind of arthritis. Now, if you go to a
Mhm.
CMP exam and normally you can't bend your back all the way down,
Yeah,
but maybe you're having a good day, well, that's not really the a correct picture of how your day-to-day life is. You're just having a
right.
good day. That shouldn't be what your rating is based on. So the examiner is required to ask you, okay, do you have flare-ups of your condition? How does that prevent you from moving? Which, can you give me an estimation of things, movement that you have during that time?
But it's important to clarify that, isn't it? And I mean, maybe even volunteer it at your CMP exam, because if you're happen to be having a good day, the day you go to your CMP exam, you might want to volunteer that information. Maybe you were unable to get off the couch for 3 weeks, and now you're finally, week 4, and you're doing a little better, and you work your way up to be able to go to this exam, and then they're like, well, you can walk just fine. I mean, and after you've been 3 weeks basically immobile. So
Exactly.
I know that one of the issues that we used to always have, and probably still do, is when people are asked questions, they don't keep their worst days in mind.
Hmm.
And so they're answering the question based on, well, today I feel pretty good. So I'm going to tell you how I'm feeling today. but really what they should be talking about is the way they feel most of the time, right? Or the problems that,
Exactly. And
yeah.
with a condition like that, I think it's always a good idea. I mean, whether you're going for compensation or not, when you have conditions that can kind of vary from day to day, I think it is very important to keep a journal, record a history, a log of, how you're feeling when you have flare ups, that kind of thing. That's just
Mhm.
helpful for your medical history, and it's very helpful for your VA claim.
I heard about this painful motion rule.
Mhm.
Is that the same thing that you were talking about before when you gave us that wonderful example with the flexion and or is that something else?
That's different. That is what I was saying. Mostly it's going to be based on range of motion, except so the painful motion rule is essentially if you have arthritis, um, you may have it, but you don't have it bad enough to limit your motion to the point where you could get a rating. However,
Mhm,
you do suffer from pain. You do have the condition. It just isn't enough to warrant a rating based on your range of motion. As long as you have the diagnosis of arthritis and you have painful motion of that joint, you
mhm,
can be rated at 10%. Now that is different. You can't get a rating for painful motion and a rating for limitation of motion of the same joint. So for
mhm.
example, of course, if you can't, cross your legs over each other without it hurting, of course that's painful. But you're going to get a rating based on the limitation of movement, not of the pain.
It's almost like we have these main conditions, and then we always hear about, well, can there be secondary conditions that you can be service connected for? We've talked about that before with hypertension, and we've talked about that with diabetes. So it begs the question, when it comes to arthritis, are there secondary conditions that you can be service connected for when it comes to arthritis, or vice versa, where arthritis is the secondary condition as a result of another primary?
Sure. So, a very common one that I see, and it's very understandable, a secondary condition of arthritis I see a lot is depression or mental health issues. Because you think about it, if you're in pain from moving every day, or even just, you do have the exacerbations, that's going to take a toll on your mental health. You're not able to do things that you may otherwise be able to do. That's not going to put you in a good place. You're in pain. You might not be able to work. So that's something that I have seen. I have seen secondarily service connected. Second to arthritis.
Can you tell everyone what TDIU is? Not the whole explanation because that's a whole other video blog, but what it is, and can you get it based on arthritis?
Sure. So TDIU is when the VA essentially recognizes that although you're not 100% schedularly disabled, so your ratings don't total up to 100%, you are unable to work due to your service connected conditions. So that's a case where basically you can get a 100% compensation, monthly compensation payment, but you're not at 100% scheduler.
Mhm,
So yes, you could absolutely get that with arthritis. That being said, you do have to have a rating of at least 70%, a combined rating of at least 70% in order to get TDIU.
mhm,
But if arthritis, you had those ratings for arthritis, as I mentioned, you can have ratings for multiple joints. You can have multiple ratings for multiple joints.
mhm.
So it's not uncommon to see a high rating, high combined rating like that with arthritis, and you show that you're unable to work due to your condition, which should be pretty apparent. If you're in terrible back pain all the time, you can't,
Right,
bend your knees, you have trouble walking, you have to lay flat. Well, obviously, like working's not really going to be something that is going to be within your ability.
right,
So
right.
it is possible to get those benefits for arthritis.
What about special monthly compensation? Is that a possibility? And aid in attendance. So, in other words, all these other benefits, do they come into play when it comes to arthritis?
So they can. So a issue I would see with special monthly compensation coming in is essentially if you have a rating that's either 100% disabling or you're receiving individual unemployability for that
Hmm.
condition. So, for example, let's just say we have a client who has PTSD, he's receiving TDIU for it. So that's going to be considered 100% disabling. Let's say he also has separate arthritis ratings that equal up to 60%.
Hmm.
When you have a 100% or TDIU qualifying condition and a separate ratings of 60% for other conditions, you can get special monthly compensation. Similarly, for aid in attendance, if you're service connected for arthritis and you have evidence showing that your condition's so debilitating, you have to have someone take care of you. You have to have someone, prepare your meals, help you in and out of bed, help you in and out of the bathroom, etc. You could receive that as well.
So lots of benefits available basically for all things arthritis.
Yes, and I will say a very common thing, claims that we see for arthritis are increased ratings.
Mhm.
Because as you might imagine, well, especially degenerative arthritis, it wears down over time. So you generally, I don't see arthritis case that's going to get better. So that's
Mhm.
also something to keep in mind if you are service connected for arthritis, but it's been a while or you feel like you're getting worse, you can always file a claim for increased rating that is recognized that these conditions aren't something that improve over time.
Thank you for joining us. If you have any questions, feel free to contact us. You can visit our website or call our office. And otherwise, we hope you'll join us again.